In this video, I will talk a little more about root canal treatments. I have made a video about root canal treatments years ago. So this is kind of an elaboration because people that follow my advice, they have a problem when they go to the dentist because the dentist see things from quite another view than I do. And dentists believe that bacteria are dangerous, that they cause harm, and that if you don't treat a tooth with infection, then the bacteria will enter the bloodstream, attack your heart or your brain, and you will die from it. And yes, it does happen. I have heard about it. But when I worked as a dentist for 25 years, I never experienced it once. So it cannot be that huge a problem. But of course, you have to take your precautions as a dentist so you don't cause people to die from not treating them. And as a dentist, you don't know who is in risk of dying of this infection. Because as a dentist, you don't acknowledge the body-mind connection. Dentistry built upon the assumption that body and mind are separate. You are either physically sick or mentally. So once you acknowledge that body and mind are a unit, then you have to change the whole perception. So when you have toothache, it's your body that creates this toothache. It comes from stress on an area of your life. You have a very stressful situation, and your tooth responds to that stress. And when you have a stress reaction, stress hormones are released, and you have an increase in pulse, an increase in blood pressure. And inside the tooth, if you have increased blood pressure, then there will be a very high pressure inside the tooth because it's an almost closed space. And this high pressure will cause this immense pain. So when you go to the dentist and the dentist say, well, we need to make a root canal treatment and drill down to where the pressure is inside the root canal. Once the pressure is taken, then the pain stops. And I suggest that the dentist doesn't treat anymore. Normally, you would rinse out and take out the tissue and clean inside the whole root canal because you want to take away all the tissue so that the bacteria cannot live there again. But that's an illusion. Bacteria are present everywhere. Everywhere where there's dead or dying tissue, the bacteria will come. But it was never about the bacteria. So you don't have to clean out all the tissue. Let me make a parallel. If you have a severe head injury, then the pressure will rise inside skull. And of course, the brain will not be able to survive that. So that's why there is a treatment where a piece of the skull is taken out so the pressure can fall. So there's not this increased blood pressure inside the skull. So this is a treatment that we know, but I suggest that we do the same in teeth. So we have to take away this high pressure very early on. Otherwise, the tissue will die inside the tooth. It cannot endure hard high pressure for a long time. So if you can take the pressure very early, then the dental pulp can go on living. And we prefer to have living teeth. And root canal treated teeth are dead, all of them. And sometimes teeth die anyway. And for me, I don't see that as a huge problem. I prefer living teeth, but I'm not scared of dying of dead teeth. So they don't have to be removed. They don't have to be filled up with material. What we need to know is which area of life does this represent, and then work on the emotional state. Take away the stress situation, make changes in your life. So I want you to share this information with your dentist, because if this resonates with you and you go to the dentist and say, well, I don't want a root canal treatment, I want you to just take the pressure off, then your dentist will, of course, have resistance on this. But when the toothache starts, then there's not even bacteria present in the dental pulp. The bacteria will come later. So it is the physical response that creates this toothache. So if you deal with that, take off the pressure, then there's also another solution, that is taking off the pressure of you, so you are no longer in this state of stress. If it is at your work, for instance, that you feel this immense stress, I'm not saying it's easy, but you can remove yourself from the situation. And if you do that, then the toothache will stop. It's not easy. It never was, because then you would already have done it. But this is an option also. You can either do the physical, drilling down, or the emotional, remove yourself from the stress situation. And if you have a discussion with your dentist about this, just show your dentist this video. And if you are a dentist, then you'll probably think that I am, I have lost it. I'm so way out. But I want you to embrace this. I want you to maybe use your own senses. Because when we are educated to be a dentist, then we have very much indoctrination. We hear that this is the truth. But since dentistry built upon the assumption that body and mind are separate, then there are so many mistakes that arise from there. So ask yourself, do you believe that body and mind are separate? Or do you know, I mean, even children know that body and mind are a unit. They know that when they are sad, then there are tears coming out of their eyes, of course. And when they are sad, then maybe they have pain in their belly. So ask yourself, is it really true that body and mind are separate? Or what will happen if you embrace the fact that body and mind are a unit? When you acknowledge that emotions have an impact on our whole body, and since teeth are part of the body, there must be an impact on the teeth as well. So have a conversation with your patient and try to be friendly. Try to be friendly with yourself also, and not be scared of this new way of seeing it, because this will be more and more the way that people want to think, and it resonates with more and more people. So dentists have to change, even though that's very unpleasant thought. So try to embrace it. And I really hope that you do, that this will resonate with you. So this is just something I wanted to share with you in this small video. Thank you.